Hi, this is Dr. Darwin, a new dentist coach, and welcome to another episode of Ask Dr. Darwin, where you ask questions about pursuing careers in dentistry, whether it be as a pre-dental student or current dental student looking into residency or even life after residency. I'm here today with the student, Dr. Quinton Cobb, who has some questions, but also be sure to, if you have questions also, you want to ask me, send them to me at newdentistcoach@gmail.com, newdentistcoach@gmail.com. Feel free to subscribe, as I will be posting on every Monday of the week. So, student Dr. Cobb, welcome. Welcome. Tell us a little bit about yourself.
My name is Quinton. I currently attend the Dental College of Georgia. I'm a junior student right now, so I'm just now starting to look at GPR programs mainly, also looking at some AGD programs as well.
That sounds good. This sounds good. How's everything down at Georgia College of Dentistry, Augusta University, Medical College of Georgia? What name is it this year?
Right now, it's the Dental College of Georgia. They've changed it a few times. When I started off, it was the Georgia Regents University, and then a couple of years ago, it was the Medical College of Georgia. So it's changed a few times.
That's right. Well, as long as the name that's on your diploma is the name that it needs to be, that's all we care about, right?
Yeah.
So it sounds like you're getting ready to get into your D4 year later this summer. Looking into some residencies.
Yes.
Quick question: Do they have like a residency like fair at the Medical College of Georgia or Georgia Dental School? Do they have people that come in and kind of
no
about it?
No, they do not. We've got some free emails from other schools like Meharry College, though, which is not too far away, and they're having a fair at their school. So I may travel up there in a couple of months and visit that fair.
Okay, well, you know what? That might be an opportunity for the school or maybe one of the associations, the student-run associations, to host something, because I really feel those types of programs are very helpful, especially, for everybody, even people who are maybe have not really thought about it. It may help them start to consider it as relates to plans after dental school. So maybe offline, we'll talk a little bit more about maybe bringing or creating some type of program through one of the student organizations. So so I'm here today to kind of answer your questions, man, about residency and other things that you may have on your mind. So go ahead, shoot.
So one of my questions is, I guess, what are some of the main things that I guess the residents should take out of a program, of a GPR program?
So what are some of the main things that residents or candidates, residents should take out of a GPR program? Well, one of the things that you'll definitely notice immediately,
yes,
depending on which program that you go to, is your speed. Your speed is going to increase tremendously. You're going to be going from 2 or 3 patients now as a dental student to, you could be going anywhere from 6 to 10 to 12 patients a day, all depending on what kind of program that you're in and what kind of program, how it's structured and how the patient flow is. So that's going to be one big takeaway, which is going to be your speed. All right. I think the second thing that residents take away from doing a residency is your confidence. All right, your confidence, in the sense that you're going to be doing procedures, some of which are similar to dental school, but repeating them over and over and over and over again. And with that repetition, you have what we call certainty. You're more certain about how to do it because you're doing it constantly. You know, in dental school, you may only have 1 or 2 opportunities to do a couple of bridges, or 1 or 2 opportunities to do a molar root canal, or even any type of root canals. I know in some schools that experience is very minimal. In a residency, you'll be doing a lot more of that. So with that comes you feeling more confident, being more certain about yourself, and your abilities to do those types of treatment. And I think the third main thing that you'll take away from a residency is being able to continue to strengthen your treatment planning skills, right? Treatment planning skills. You will be able, you'll be presenting treatments very similar to you how you do it now in dental school, but you're also going to be presenting to attendings and faculty members within the residency that have various different backgrounds. With those backgrounds come various different experiences, various opportunities where they actually have treated different types of cases. So you may be thinking a treatment plan with A, B, and C options, but when you present and you do what we call like a treatment plan timeout, where you have an opportunity to have some teaching and learning and having it maybe a little bit more one-on-one, you'll learn other options to add to your treatment plan, and you're going to learn some of the reasons why maybe option A and B that you had in your treatment plan may not be the best option. So I think those are the three key points that you're going to take away from a residency.
Okay.
What else? What else you got?
So I guess for me personally, I've had to repeat a year of school. So I guess what are some of the things I can do to, and I guess, better myself as an applicant for your GPR programs?
So you're asking how can you increase your opportunity to be accepted into the residency, given your current status?
Yes.
School. So
yes.
I would tell you one of the main things that you have to do is, no matter what programs you apply to or what programs you get into, the only way that you can get into a residency ultimately is you got to graduate. All right, you got to graduate. I know it sounds simple and sounds kind of basic,
okay.
But every year we've got some people that we match with or that are planning on coming to a residency, and for whatever reasons they just have had some struggles trying to get the last bit of requirements, and they can delay their start or even eliminate them of being able to start a residency. So the first thing, man, is you really got to concentrate on your requirements coming up this D4 year. Just putting a lot of effort and attention on finishing. You got to get through. You got to get done. Second thing is, one of the things I think will help you with your candidacy is going to visit programs that you may have some interest in, AKA a site visit. Doing a site visit. And what that does, I think, for most candidates, it helps you kind of confirm whether or not this is a program that you want to apply to, because when you start applying to programs, it costs money, it costs time, it costs effort. You want to make sure that the programs, the 10 or 5 to 10 programs that you have in your list, you want to make sure that they are bona fide programs that you're interested in. So I think doing a site visit helps with a lot. It helps to kind of bridge the gap as to what you see on the website versus what you see face to face. And then it also will kind of let the program directors and the people that are at the program, it tells us that, you are a serious candidate as far as taking the time and the effort and spending the money in your busy schedule as a student to come and visit, especially if it's out of town, even if it's not out of town. But that shows us that you're taking the initiative and you're taking this next phase of your career seriously. So I think that helps you in boosting your candidacy. One of the other areas that can help your candidacy is your credentials, right? You have your personal statement, you have your referral letters, and you also have your other credentials like your GPA and those types of things. So with that last item, some schools don't have GPAs anymore. It's just pass fail, which can help or hurt depending on which school you go to. Reference letters, so very important. You want to really make sure that you have strong reference letters from people that can attest to who you are as a student dentist, attest to not only your clinical skills, but your character. Very, very important. So if you, as you kind of finish out this third year, you want to make sure that you zero in on a couple of faculty members that you feel comfortable with, that you've had some strong, or you're building a strong relationship with, because those are the people that are going to be able to attest to you and who you are, both clinically and as a person. So that's important about the reference letters. And then your personal statement. Your personal statement is key because it is a window into who you are as a candidate. I always tell candidates to make sure you tell a story. Everyone likes reading stories or hearing about stories, and everyone has a unique story as to whether or not how they got into dental school, or they may have a reason why they decided to become a dentist, or one particular focus that they may have within the career that they're looking, or that they aspire to get to, and how residency is going to help them do that. So tell a story, find something unique about yourself that kind of has self-motivated you to pursue this career, and even more how it's going to pursue a residency. And you also want to include in the statement how you are going to contribute to the program. All right. How are you going to contribute to the program? And with that, you have to do a little research to find out more about the different programs and their mission and their purpose and how you fit into that, but also how you're going to contribute to that. It has to be a win-win. You have to contribute, and in exchange, you're going to get the training. You're going to get the mentorship. You're going to get the increase of confidence. But it has to be a win-win. It can't be just kind of one-sided. So I think those three things are things to think about when you are considering increasing your candidacy.
Okay.
Do you have a list of programs that you're considering so far? Are you starting to develop that list?
I'm just now starting now. Honestly, last year I wasn't even thinking about GPR programs. I was just trying to concentrate on graduating. And as I'm being a little bit closer, I'm kind of starting to see the benefit of it. So
yeah, now's the time.
Yeah.
Now's the time, man. So that's good. That's good. Whatever. I think we have time probably for one or two more questions.
Okay. So I've heard kind of mixed opinions about programs and placing implants. Some people think that the GPR program doesn't offer options of placing implants. It's not worth it. What is your opinion on that?
If the GPR program is not placing implants, it's not worth it? Not worth what? What's your question?
Yes, like most people think that you should look for, not most people, some people think that you should look for a program that is placing implants within their program.
Okay, well, it all depends on the person. That's what you said a mouthful right there. Some people think. It depends on if you have an interest in placing implants. I will tell you, just like 2 years of clinical training in dental school is not going to completely prepare you for everything that you're going to see in private practice, 1 year of residency training is not going to prepare you for everything that you're going to see in private practice either. And then you take a small segment of that comprehensive care and you take implants being part of it. A GPR program, especially the ones that are more comprehensive in nature, will only have a portion of that will be some implants, right? Comprehensive care is just not only implants. You got perio, you got endo, you've got other options. Other areas, pediatric dentistry also. So, again, it goes back to what type of things are you looking to do? If you want to specialize in implants or get more training in implants, there are some programs that'll help you continue to learn. But I will tell you, probably the best experience for a lot of GPs learning or wanting to learn how to place implants and do it the right way, there's a couple of these maxi courses throughout the country. Actually, where you are down at the Medical College of Georgia, Dental School of Georgia, Augusta University Dental School, where you are right now, there's probably one of the best programs in the country. I've had a couple of colleagues from dental school who have been accepted and enrolled in this year. It's a year-long program. They're doing it as they're running their private practices. It's usually maybe 3 or 4 days a month, like a Thursday, Friday, Saturday, Sunday. And they're actually going all the way back to basics, back to a lot of the basic sciences, all the way through implant placement. It's a real comprehensive 1-year program that they're doing. So if you want to learn how to place implants and do it the right way, it's going to take some time. And 1 year GPR is not enough time, especially if it's a comprehensive care type of program. Now, I will tell you, there are some AEGD programs and there's some GPR programs, whether it's like through the VA, that maybe have more of an emphasis on implants. But then again, like I said, you've got to really do your research and find out, how, what that implant placement type of opportunities are. And again, it's also going to vary on the population of the patients that are being seen within the program. So I don't think just because a GPR program doesn't place a lot of implants is a waste of time. You may think it is because that's all you really want to do, but 1 year is still not going to be enough to give you, enough adequate foundational training to do it. There are a lot of these weekend programs that you can go to Mexico or go to Dominican Republic or either other parts throughout the country where you can learn, but how much can you learn in a weekend? I mean, there's only about 24 hours in a day. How much can you really learn in a weekend? You'll learn some stuff, but you also may learn some tendencies that may not be favorable long-term in actually placing the implant. You got to remember, when you're placing implants, it's more than just actually placing it. The actual placement of the implant is probably the easiest thing. Yeah. It's all in your treatment planning, your case selection. Yeah, all those different factors. And then you have the follow-up. You have the occlusion you have to worry about. So it's more than just actually placing the implant. And I think one of the things that happens lots of times with new dentists, they get really, really anxious and really excited about, all right, I'm out of school now, I want to place implants, and not understanding that it also is a process. So be sure to look at different programs and try to find out how they're placing the implants, but also know that you can use your GPR year to continue to learn. And maybe, if you have some time where you have educational leave or time away from the program, that'll be the time for you to take some CE courses as a resident to start learning more.
Okay. All right.
You good? I think we have time for one more question. Let's do one more.
Well, I have more like program specific questions, if that's okay, about the Bronx Lebanon program.
Yeah, I think we have time probably for one or two.
Okay, so I know you talked about there's a rotation in sedation. I was wondering if I guess the residents are able to apply the sedation to their clinical experiences when they're seeing and treating patients through the other half of the program.
So basically here at Bronx Lebanon, we have what we call an oral surgery rotation, and it's 6 weeks long. And part of that rotation, residents are required to do IV sedation consults, where it's the pre-op for the patient who's being considered being considered for sedation. The residents work directly with the attendings or surgery attendings, but they also work with the oral surgery residents that we have from another hospital that rotates in and gets training at Bronx Lebanon. So that experience for IV sedation, that's the only location in the department where we are doing sedation. It's only in oral surgery. So that's the time that you'll have that experience to work. Now, there are other means of not necessarily sedation, but we use nitrous, and we have nitrous pretty much throughout all the 5 locations. So you can use that method of fear control and anxiety control, sedation, and that's
Okay.
in addition to that, when you're on the pediatric dentistry rotation, and also when you're on the anesthesia rotation, you are learning anesthesia. You're learning managing children. Usually those kids have to be, put to sleep to get a lot of their treatment done. So that's some exposure to it there. And then, of course, in anesthesia, you're going to be having a 2-week rotation where you're learning general anesthesia management, airway management techniques, and you're actually going to be working on a couple of cases with ENT one day out of that 2-week rotation. So that's pretty much the extent of sedation. Again, there's a lot out there outside of the residency that you can learn, that you can become a little bit more proficient and get more training. DOCS, DOCS. If you look it up, you Google it, they have a conscious sedation program that's pretty intensive. A lot of practitioners get that training, get that certification, so they can bring conscious sedation into their practice. So again, another opportunity to continue to learn.
Okay.
And we got time for one more question. Yep.
So would you think that the population base is more of an elderly based or a younger based? Will I be doing, or will residents be doing a lot of removable prosthodontics?
Versus what? Other types of procedures? What other types of procedures?
Just like fixed prosthodontics and other things in general.
Yes, yes, and yes. You'll be doing removable. You'll be doing some fixed. You'll be doing some extractions. You'll have opportunities to possibly treatment plan and place implants when they do them over in oral surgery. You'll be doing single unit crowns and multi-unit crowns. You'll be restoring some implants, all the above. So, we've got a vast patient population from, under 12 to over 80 years old. So whatever they need, however it fits into the treatment plan, and based on what they need, residents will get exposure doing it.
Okay. All right.
Good.
Thank you for taking the time to answer my question.
Hey, no problem, man. I will tell you also, when this process that you're getting ready to start early. Start early in the process, because you really can't anticipate how much time is really going to take. So as you're winding down the 3rd year and transitioning to your D4 year, make sure you block out some time, significant time, so you can do your research and programs, start networking, asking former graduates of the dental school, if you have access to them, maybe where they did their residency training. The admissions, the student affairs may have, or alumni affairs may have a listing of, people that have been, that have graduates of the school from the last 5 years. That may be a source where you can kind of call and contact and kind of get some information from alumni as to where people are going to.
Yeah, I've kind of already started that right now with some of my former classmates as well. So
yeah, I think that's key. That's very key, especially since there's no formal program for you all as D3s, rising D4s, that kind of introduces you to the various types of residency programs with AGD and GPR, because there's over 300 of them all throughout the state. So it's a lot. Yeah. But so be active. Also, be active in recruiting. Letters of recommendation, faculty members that you like working with and that like working with you. Those are, main sources of letters of recommendation for you. Start early and requesting that. They will ask you for maybe a copy of your personal statement. They're going to also ask for a copy of your CV, and they're probably going to, sit down and want to talk to you about, why you're thinking about, pursuing it, so that they can get the more information you give them, the better your letter of recommendation will be. So keep that in consideration as you are starting early. And like I said, site visit, coordinate it so that if you got 3 or 4 programs that are maybe in the same area, try to knock them out within, the time that you're in that area. Try to, coordinate it over a period of 1 or 2 days. So good luck to you, man. I wish you the best. If you have any more questions, anything I can help you with, just send me an email, newdentistcoach@gmail.com, newdentistcoach@gmail.com, and feel free to share this video, this information, and my email address too. If you have some other classmates like yourself that are considering residency, I would also invite you to subscribe. I have a playlist in YouTube. The YouTube channel, Dr. Darwin Speaks. There's a playlist under residency, and there's some tips and some strategies that I think could be helpful for you during this process. Thanks so much, student Dr. Cobb. I wish you luck, and we'll be talking soon, I'm sure.
All right, thank you, definitely.
You're welcome, you're welcome. Thanks. See you next time.
All right, have a good one.
All right.
All right.